Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. A reminder after the pep talk is to take the online learning evaluation test exercise for mastery of learning and get a perfect score to get a certificate like the one shown here. I have placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now, show your face. Okay, ready? 1, 2, 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control of the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. Come to think of it, it's already COVID pandemic started March 17, 2021. So we're now on our fifth anniversary of the COVID-19. Anyway, there are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 18, 2024 marks the start of year 4 of ROJoson PEP Talk. So we are near the completion of the 4th year. So we will start the 5th year cycle on May 18 or 19, 2025 this year. How long the pep talk will last will depend on the enthusiasm, discipline, and perseverance of everybody, myself and you. My pep talk today is entitled, How Patients Can Manage Illegible Handwriting of Physicians in Medical Documents. The empowerment objective is to have an essential understanding on how you, the patients, can manage the illegible handwriting of physicians in medical documents. The contents of this particular pep talk will be the following. What is illegible handwriting of physicians? In what medical documents are illegible handwriting of physicians frequently encountered by patients? What can be the potential ill consequences of illegible handwriting of physicians on patient care? How can patients manage the illegible handwriting of physicians in medical documents? What are ROJoson's practices in promoting legibility of handwriting in medical documents? And lastly, what are ROJoson's advice to medical students who will one day be physicians, physicians and managers of healthcare facilities on the legible handwriting of physicians? A disclaimer, the ROJoson PEP Talk contains my thoughts, perceptions, opinions, and recommendations, or what I call TPORs, culled from personal experiences as well as from the writings of other health professionals. Let's start with the first topic. What is illegible handwriting of physicians? I would operationally define this as illegible handwriting of physicians means the handwriting of physicians on medical documents that are not clear enough to be read. It's as simple as that. They are not clear enough to be read. In what medical documents are illegible handwritings of physicians frequently encountered by the patients? Number one, the most common, the prescriptions for medicines, which are to be filled up by the pharmacist. Number two, prescription for diagnostic tests to be done by the patient. Three, referral letters to medical colleagues. And number four, admitting orders to healthcare facilities. So these are the more common medical documents that are produced by physicians in which there are illegible handwritings encountered when they use the hand. If they use computer or digital typing, there's no problem. But if they use handwriting, you usually encounter this illegible handwriting on these four types of documents. What can be the potential ill consequences of illegible handwriting of physicians on patient care? Foremost is miscommunication. Miscommunication means the failure to communicate adequately the intended message of the medical documents or failure to make the information clear to the intended receiver. So they may eventually or essentially lead to, number one, wrong drugs being filled by the pharmacist and administered by the nurses or by the patients themselves. Number two, wrong diagnostic tests and procedures done to patients. That's another ill effect. Then unnecessary medical expenses because of errors from illegible handwriting, usually repeating tests, buying new drugs because of the errors committed. Okay? So wrong drugs being administered, being filled by the pharmacies, wrong diagnostic tests being done on the patients, then unnecessary extra medical expenses because of errors. How can patients manage the illegible handwriting of physicians in medical documents? First of all, is situational analysis. Illegible handwriting of physicians are common, if not rampant, in medical documents, not only here in the Philippines, but also abroad. The exact causes of illegible handwriting are not known. Mahirap sabihin kung anong exact cause. Some hypotheses provided are the following. No proper training on legible handwriting before and during medical school days, which may be the more likely cause. And then the other possible hypothesis would be physicians always in a rush to write, always in a hurry to write things, to get things done para matapos na. So no proper training. Kasi kung maganda ang training, basic training in undergrads and also in medical schools, no? So most likely maganda yung handwriting. Maganda means at least legible. Doesn't have to be beautiful, but what's more important, it can be read. And then the other hypothesis palagi sinasabi ng mga ibang mga doktor, kasi nagmamadali kasi sila, no? Which is probably not a well-founded reason. There is a worldwide acknowledgement of and negative feedback on the rampant illegible handwriting of physicians since time immemorial. Matagal na yon. No? So, ina-acknowledge ng all over the world na pangit, marami ang pangit ang sulat ng mga doktor. And then maraming nag-criticize. No? But up to now, wala pa ring improvement. The only improvement that we can see is that when they use mga computer or digital printing of documents, no? Even the prescription pads. There are attempts to improve the negative situation. However, nothing much has changed or improved in the legibility of handwritings of physicians except for the use of computers or digital technology to mitigate the ill effects of illegible handwritings. Digital technology, electronic medical recording, or computers cannot totally eliminate the problems of legible handwriting of physicians because there will be always situations in which physicians have to handwrite something in patient care, no matter what. Personally, I don't think it will disappear, the handwriting need or the situations. Then computers for writing may not always be available in all instances, in all communities, in all countries. And when computers, when available, can partly mitigate the problems of illegible handwriting of physicians, but not totally eliminate it. Because there'll be still situations in which handwriting of physicians would be needed. So in this writing and this pep talk, I will not dwell on the mga causes. No? I just mentioned two kanina, hypotheses, but I will not dwell on the in details the causes of illegible handwriting. I will not dwell also on the solutions to promote legible handwriting of physicians in medical documents. What I will do is just dwell on how we or you patients, or I probably in the future when I am a patient, can manage illegible handwriting of physicians of medical document. Ito lang ang topic, ang part of the lectures that I will focus on. How you, me, as I said, baka in the future I will be a patient also. I will have doctors probably with illegible handwriting. How we can manage this illegible handwritings. When I say manage, this means to mitigate the situation or the problem, to ease the difficulty, to avoid the ill effects of illegible handwriting of physicians. Kung pwedeng mawala totally, masolve yung problema, okay lang. Kung hindi, how to mitigate, how to lighten the problem. I will focus on illegible handwriting by physicians in the following. Dito lang muna, prescriptions and also for the medicines will filled up by the pharmacies. And then prescriptions for diagnostic tests. I will not dwell much on the admitting orders and also the referral letters to the colleagues of the doctors. We will just focus on the prescription for medicine and also prescription for the diagnostic test in this particular pep talk. Before I go to my TPORs on how can patients manage the illegible handwriting of physicians and medical documents, I like to categorically state that it is a patient's right. I repeat, it is a patient's right to expect and demand illegible handwriting from physicians. That is, if they have to do handwriting on official documents associated with medical care. So if the doctors will have to do handwriting on medical documents, it is the right of the patients to expect that when they do the handwriting, it should be legible. Kung hindi, they look for other means like i-computerize nila. Number two, It is the right of the patients to be protected from miscommunications that may arise from the illegible handwriting, which may in turn cause ill consequences in patient care. So, I repeat, patients' right to expect and demand illegible handwriting kung nag-handwriting pa siya ng doktor. And then, it also, concomitant with this right is that it is the right of the patient to expect to be protected from miscommunications, mga errors that might ensue because of illegible handwriting. My foremost overall recommendations will be the following. For the patients, I recommend proactively requesting physicians to write legibly, particularly the prescriptions and medical instructions that they will be receiving from the latter, meaning from the physicians. Always read the prescriptions and the medical instructions given, and then always ask if clarification and verification are needed. So don't be afraid to ask, don't be shy to ask, no? Don't assume that the doctor, don't just let go of the legible handwriting because ang consequence ay nasa inyo, no? Nasa atin as patients. No? So this is part of our patients' rights. So to ask the doctors, the physicians, kung pangit ang, kung di clear ang sulat niya, then you ask, you know, and also the instructions. Specifically, once a patient is given a handwritten prescription of medicines or diagnostic tests, he or she or a relative or a guardian has to look at it and determine the legibility and illegibility of the patient's handwriting. So hindi lang kukunin yung prescription and then bahala na and then just give it to the pharmacist or to the yung mga technicians doing the lab, then pagdating doon, baka medyo huli na. Okay. So right after the prescription has been handed to you, take a look, or even while the physician is writing, tingnan na lang nyo kung legible ang handwriting. So he or she doesn't have to understand what are written initially. What's more important is to be able to read what is written there. So as a patient, you may not be able to understand what is being written, but at least just focus on whether the handwritten letters, yung mga letters, A, B, C, D, gano'n, are legible or not. Yan ang unang titingnan. First thing to do. Note, priority to see if all the handwritten letters are legible or not. Legible, when you say legible handwriting, means all the handwritten letters and not the words are clear enough to be read. So bawat letter, let's say L-E-T-T-E-R-S, bawat alphabet nito should be clear enough. So do not determine the legibility of letters using the context of the words or instructions or any other clues in the medical documents. Kadalasan ginagamit natin yon. I think the pharmacists are also doing that. Kung di nila mabasa, they look at the context of the mga other words na kasama dun sa prescription. But that's a risk that they are taking. Huh? So again, legibility of the handwriting refers to the legibility of each of the letters written. Bawat alphabet, bawat L, E, G, I, B, I, L, I, T, Y. If handwritten ito, dapat legible siya. Mababasa ninyo. So here are the criteria for legible handwriting. Legible handwriting means clear letter. Clear letter, the strokes and the size. Not only the strokes, but also the size. Kung masyadong maliit, hindi mo rin mababasa. Kahit na maganda yung stroke. Okay? So dapat the strokes and the size in each word written. And each stroke done for each letter should be clear to be decipherable. If the stroke is not clear, it should be corrected right away by the physician. That's what I usually do. Kung minsan meron akong stroke na pangit and baka hindi mabasa, binabalikan ko right away at kiniklear ko to make some modifications until that particular letter is legible. And then the size of the letter or words should be big enough to be readable. So remember, not only the strokes, but also the size kasama. No? So these are the criteria for legible handwriting. If all or some of the handwritten letters are not legible, politely request for help from the physician in deciphering. What patients should do? Not to be afraid because of patient's rights. Ask directly the physicians on the illegible handwritten letters. Tanong niyo kagad. The endpoint of requesting for help in deciphering is that all the individual handwritten letters of the physician must be legible and understood. Ang unang-una, priority is legible, mababasa. Later on, yung being understood na lang. After yung legibility, mauna ito. Then after that, pag legible na siya, automatically, usually, you can understand what is written already. Here are the options on how to request physicians' help in deciphering illegible handwritten letters. So these are the options. Politely ask the physician to make the needed modifications to make the illegible handwritten letters legible, especially on the prescriptions. Politely ask the physician to write in print if the longhand writing is not legible. Pakiprint na lang ho, doktor, hindi kasi namin maintindihan. No? Okay. So, then, number 3, jot down on a separate piece of paper of the deciphered illegible letters after asking the physicians for help. Minsan, hindi kinokorek ng doktor yung illegible handwriting, but after asking, you can silently o sa tabi, i-jot down ninyo kung ano yung mga sinabi niya na kung anong letters that represents the illegible letters. After ensuring that all letters in the prescriptions are legible and fully deciphered for the illegible ones, the next thing to do is to understand. So second, mauna yung legibility, then the other one is after that to understand the purpose of the drugs or diagnostic tests prescribed and their respective accompanying instructions, especially on the dosage, frequency, and how to take the medications. The patient should not hesitate to ask the help of the physicians in the full understanding of what are written on the prescriptions. Remember, it is your right, it is our right as patient. So in doing so, at times, wrong spelling may be discovered and then corrected by the physicians. And then wrong spelling can also cause miscommunications. So this may happen, wrong spelling, pero kadalasan you don't know what is spelling, but what's more important, yung legibility na lang ng mga sulat. So, what are our ROJoson practices in promoting legibility of handwriting in medical documents? In practice ko, I make sure that all my letters are written legibly. I am always mindful and vigilant on this. I don't hesitate to go back to correct and modify an illegible letter just written 1 second ago, a few seconds ago, pasusulat lang pero pangit, no, hindi mabasa, babalikan ko right away to ensure legibility of all the letters that I wrote. I usually do cursive writing or longhand writing. I am confident that I can have legible cursive writing. If I have to print letters for legibility reasons, I do so. Kung di maintindihan, baka di maintindihan ng nagbabasa, I can do printed letters instead of longhand or cursive writing. Now, for my advice to the medical students who will one day be physicians, because I also have to reach out to the medical students as part of my advocacy to help solve the problems of illegible handwriting of physicians. I hope I can contribute to this advocacy. So for the medical students and physicians, you cannot totally avoid handwriting now and in the future, despite the presence of aid from digital technology in writing. There will certainly be situations in which you have to do handwriting in your medical documents. Always think of the purpose of the handwriting in medical documents, which is communication. Be conscientious in writing legibly to avoid miscommunication, which may lead to wrong drugs being filled by the pharmacies and administered to the patients, wrong diagnostic tests and procedures done to the patients, and unnecessary medical expense because of errors from illegible handwriting. So if the medical students and doctors are aware of these possible ill consequences, if they are compassionate enough, they will try their best to do legible handwriting. Now, for the managers of the healthcare facilities, like the owners, importante din mga owners of hospitals. That's why we also want to look for quality hospitals, yung mga excellent hospitals. So for the managers, as much as possible, pero hindi ginagawa pa ng mga managers dito sa mga hospital, make it a policy and practice for physicians to always have legible handwriting in medical documents if they have to do handwriting. So they have to ask the doctors to do it to make sure that when they do handwriting, make it legible. Now, if needed, they can conduct a training course for legible handwriting, okay, to avoid the ill consequences of illegible handwriting, particularly patient safety. It doesn't have to be beautiful. What's more important, legible siya. So legible and not beautiful handwriting is the aim. And what's more important for the managers, because mga accreditation, mga external accreditation, they usually look at the patient's safety. Since illegible handwriting can promote unsafe patient practices, so the managers should make sure that all their doctors are doing legible handwriting if they have to do it. Kung di nila magawa, then i-computerize na lang lahat, kung pwede. So, as I said, legible and not beautiful handwriting is the aim. Ito, maganda ito, but you don't have to be as beautiful as that. Okay. Ang ganda, Okay. Very clear, beautiful, but also legible. Okay. So, pwede na ito. So, legible yung mga letters. Tramadol, paracetamol, 20, 1 tablet every 6 hours. Okay. Then ito, examples of illegible handwritings of physicians. Kayo, hindi mababasa. Ako rin, hindi ko mabasa as a doctor. Hindi ko rin mababasa yan. I don't think the pharmacists will be able to decipher what. Ang mababasa lang natin, probably 30. The name of the drugs, probably about 10 something, 10 milligrams, whatever. Hulaan na lang, Okay. Another one, example of illegible handwriting. 120, yan ang mababasa mo. The rest, I don't know kung anong nakalagay dyan. Okay. So, a wise doctor once wrote, so you call him wise. So here are comments of Filipinos on illegible handwritings of physicians which were given to me in the past as well as now. Akala ko talaga it's being done on purpose, parang secret codes that only doctors and pharmacists would understand. I have always wondered about these two, yung illegible handwriting. Kala ko may sarili silang style ng pagsulat like the stenographers. Minsan sa Mercury Drug may nakasabay akong matandang babae na may reseta. Walang makabasa ng reseta kaya pinabalik siya sa doktor. Kawawa naman. So that ends my pep talk. Okay. In summary and takeaway, I presented all these items, these subtopics. What is illegible handwriting of physicians? In what documents are illegible handwritings frequently encountered by patients? What can be the potential ill consequences? How patients can manage? Okay. I didn't dwell on the exact cause. I didn't want to offer mga solutions, but on the handwriting of the doctors. But what I focus here is how you can manage the illegible handwriting of the physician so that ma-reduce yung mga ill effects. And what are my practices on promoting legibility of handwriting in medical documents? And what are my advice to medical students who will one day be physicians, then mga certified physicians already, and then managers of healthcare facilities on legible handwriting of physicians. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on illegible handwriting of physicians. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on how to manage the illegible handwriting of physicians in medical documents. So with that, I end my pep talk today. I hope I have empowered you to have an essential understanding on how you patients can manage the illegible handwriting of physicians in medical documents. Before we go to the QA, question and answer portion, reminder after the pep talk, please take the online learning comb evaluation test exercise for mastery of learning and get a perfect score to get a certificate like this. I have placed the link in the chat box. And then reminder again, obtaining 25 OLETE certificates will entitle one mentee to a voucher for ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the interactions and QA portion. Please turn on your video now, show your faces. Okay. Ready? 1, 2, 3. Okay. The floor is now open for questions, comments, suggestions. Wala na yung consultation. May consultation sa barito, handwriting. So comments na lang. Comments, recommendations, suggestions on how we can solve the problems. I don't think we can solve it to be realistic. Okay, but at least let's try to see how we can mitigate the problems. How many have encountered mga illegible handwritings of physicians? Can I have show of hands? 1, 2, 3. Ito lang. Okay pala. How about the rest? Sa ibang doktor, ha? Have you encountered illegible handwriting from me?
No,
No,
doc, you have a very nice
sulat yun.
handwriting.
Parang engineer. Oh, Doc.
Okay. Okay.
Hello.
So from other people, from other doctors, no? So have you encountered any mga bad consequences? Meron? Na hindi mabasa ng pharmacist?
Kaya mo yan? Kaya mo yan?
Hindi mabasa ng technicians on the laboratory test? Meron kayong experience to share? Wala?
Mayroon isang doktor, ako doktor.
Good. Go ahead. Perla.
Mayroon akong na-encounter na isang doktor sa Maddox. Sa Maddox, doktor, hindi ko na sabihin anong pangalan. Parang ang hirap intindihin yung mga sulat niya. Paglabas mo sa kanyang clinic, yung secretary niya ang sumusulat na kung ano-ano ang mga yun.
Okay. That's good. At least meron siyang backup.
Oo, yung secretary na niya, kasi hindi talaga mabasa eh. Kahit anong gawin ko, hindi ko talaga mabasa.
Okay.
Minsan kwento ko sa isang doktor, kami nga rin, yung doktor na pinunta, kami nga rin, hindi namin mabasa eh, sabi nga rin niya eh.
Oo.
Ang doktor, ang pangit talaga, hindi ko maintindihan ang itsura nun, sulat niya. Sabi ko, paano yung sa board exam, doktor? Ganun, kung halimbawa sa board exam, nababasa ba yun? O ganito ang ganun mga sulat nila?
Board exams sa medicine, hindi tulad sa board exam sa law. Sa law yata handwritten, di ba? Up to now
Ay,
ba?
sa law, yung magtagal ang magandang sulat mo, sa penmanship mo, doktor, sa law.
Kaya nga, yung exam sa bar, handwritten sila, di ba? I-explain nila. Yung sa doctors, ano yan?
Selection lang?
Selection lang, yung binablocken lang yung box, yung circle. So walang handwriting yon, walang
Wala
sulat.
pala, kaya pala.
Walang sulat. Kaya walang problema sa board yung mga examiners kasi
parang selection type lang, selection type.
lang, yung mga ini-encircle yung correct answer gano'n.
Kaya pala.
Oo. Pero yung mga doktor dapat marunong sumulat, Nicole. Kaya when I was a consultant dun sa isang new medical school dun sa Zamboanga, ginawa kong requirements yun eh. Bago makapasok ng medical school, yung mga criteria that I use is legible handwriting. No? Okay, hindi ko alam kung na-maintain nila. No? So, sa akin, dapat legible ang handwriting ng doktor. Kung di legible ang handwriting, it should be part of the training also sa medical school. Kung pagpasok niya, kung hindi siya legible, dapat turuan siya maging gumawa ng legible handwriting. No? Parang tinuturuan ng mga doctor how to inject, di ba? Tinuturuan nila how to examine patients. So bakit hindi isama yung handwriting?
Parang pagmamadali sumulat, parang steno, parang ganun, ganun lang. Buti naintindihan ng secretary din niya.
Yan ang weak point ng mga medical schools. They forgot. No? So, a medical school, yung pinakamagandang medical school, excellent medical schools, dapat to ensure that their graduates know how to do handwriting. Di ba? Legible handwriting. Just like when they expect mga graduates to know how to do yung mga examination, mga pasyente, how to inject, how to get blood, di ba? Skills din yun, di ba? So, handwriting is also one of the skills, di ba? Yung pagsalita ng doktor, ganun din. One of the skills that should be trained in medical school. Pero up to now, wala pang nag-enforce ng handwriting. No? So, sad to say. Ha? Okay.
Whereas sa
Oh,
bar exam, hindi ka makakapasa pag pangit ang ano mo.
mm. So, kaya sabi ko, since I have come to accept na mukhang mahirap palabanan itong issue na ito. So, that's why I said, ang topic ko na lang, how you can manage it. How you can manage it. No? Kayo na lang. Tayo mga pasyente na lang. Di ba? Kasi we are on the receiving end of this, this problem. Di ba? Okay. Okay, so tandaan na lang niyo, basta when you see a prescription na handwritten, na pangit, na hindi niyo mabasa, right away ask the doctors. No? Okay. So, the doctors, kung compassionate siya, kung talagang conscientious siya, kung professional siya, dapat ayusin niya, dapat hindi siya magalit. Diba? Yung ibang
Hmm.
doktor kasi baka magalit pa. Kung tinuturuan mo pa ako.
Oo nga.
Okay. Okay. So,
Marunong ka pa sa akin, baka sabihin mo.
okay. So, any more questions? Any issues that you want to raise? Okay. So, whenever you receive a prescription na pangit, yung hindi siya legible, no? Just ask the doctors to make it clearer, no? So, if you do that, no, not only it will benefit you, but also it will remind the doctors of yung mga ano nila, yung mga responsibilities, no? Okay. Of the responsibilities to make that to have legible handwriting, no? We always talk about compassionate doctors. Kung pangit ang handwriting, automatically negative na for compassion yan eh. Tama? Tama? Outright negative na yan eh. Di ba? So when you say a doctor is compassionate, sigurado ka, compassionate siya. Tingnan natin yung handwriting niya. Di ba? Kasi kung compassionate siya, he or she will be thinking of yung mga consequences of his handwriting in the prescription pad, in the yung mga referral, yung mga request for laboratory test. No? So kung babaguhin niya, make sure that legible handwriting, I can say at least may 1 point na siya for being compassionate doctor. Okay. Do you agree? Do you
Yes.
agree with what I said? Baka yung mga doctors, baka magalit sa akin. Okay? Any more?
No
Any
question.
Chat. Okay.
Doc, kasi
So,
may experience na ako dun sa check-up, then prescription. Hindi ko talaga kasi mabasa yung sulat niya. Pero nakikinig naman ako. Yun nga lang po, paglabas ng clinic, minsan nakakalimutan ko na, lalo pag bibili na ako sa drugstore. So, sa part niyo po, doctor, offending po ba, doc, kung just in case, voice recording na lang kami? Para lang po, just in
pwede.
case.
Yeah, you can
Hindi
do
naman
voice.
po violation yon.
Hindi. You can do voice
Ah,
recording or sabi ko kanina dun sa lecture ko, have a piece of paper, i-jot down na lang ninyo.
minsan kasi Dok, ang bilis din magsalita eh. Nahihirapan kaming sundan yung pagsulat.
Okay. Pwede.
Mm-mm.
Pwede mag-voice
Pwede naman Dok.
recording. Oo.
Okay
No
po.
problem. Although yung mga doctors, minsan, sensitive sila, ayaw nila, di ba? So
Opo.
you can always say, Doc, can I have a voice recording para, number one, sabihin mo lang, para I can review what you're saying. Number two, para baka gusto makinig yung aking mga kamag-anak, kung anong explanation ninyo, gano'n, na? Okay.
Opo.
So dapat
Thank
pumayag
you.
sila doon, na? Okay.
Correct po.
Okay. So ako, my practice, I readily agree to mga voice recording. So minsan kasi meron akong, once in a while, I have patients who medyo hard in hearing, medyo bingi, na. sasabihin ng mga relatives, yung pwedeng i-voice recording para ma-reinforce lang yung pag-explain mo, no, marinig ng ibang ng relatives, no, ganon, no.
Opo. Sige,
Yeah,
Doc.
okay. Voice recording, sige. Pero but what's so important, direct to the point, tingnan niyo yung prescription. We're talking about the prescription di ba? Yung sulat niya, no?
Opo.
Check na niyo kagad kung nababasa ninyo o hindi, no? Kung hindi mabasa, doktor, ano ba itong Is this E or this is R? Ganon. Is this T or this is I? Ganon, no? Okay. One letter lang kung minsan magkakatalo na yan Isang letter sa mga gamot, lalo sa mga gamot, iba-iba yung gamot, iba-ibang maraming complicated na pangalan ng gamot, no? Okay.
Opo.
Yung pangkaraniwan na alam natin sa English, no? Baby Spiritu, Mary Ann, Jose, alam na natin kung anong takbo, di ba? Minsan may isang letter lang, mali na, iba na yung gamot no? So make sure you understand the each letter. No? You can read each letter clearly. No? Kung di kayo sigurado, tanong nyo kagad. No? Okay.
Thank you, Doc.
Any more?
Hi, Doc. Tama po yung
May
ginagawa ng ibang doctors po sa Manila Doctors na naka-computerize na yung mga prescription.
Good.
Yung mga Opta doon.
Merong mga doctors na naka-computerize. Na?
Opo.
Okay naka-computerize. Na? Okay. So yung iba wala pa. Pero it doesn't mean na dapat hindi pa ako nagko-computerize ng prescription. Pero
maganda naman yung sulat mo, Doc Parang babae.
Maganda naman ang sulat mo.
Hindi mo na kailangan, Doc. Ang ganda ng sulat mo.
Okay. Now, I'm just saying, baka mga ibang tao, ay si Dr. Roson, luma na, hindi siya trendy, hindi siya nagko-computerize.
Ganda naman ang sulat
Ako, I still preferred handwriting. So I make sure na malinis. Saka yung pag nagbibigay ako ng medical records sa inyo, no? Tama? Nagbibigay ako ng copy ng medical records. I have to use handwriting at the same time na explain ko sa inyo, no? Kasi kung computerized, tumitingin tayo sa TV monitors, di ba?
Opo. Sa inyo po may drawing pa
May drawing.
Kaya maganda.
Yeah, mas madaling mag-explain with handwritten drawing, di ba? Kasi mahirap din mag-draw doon sa computer, di ba? Okay. Okay?
Thank you po, Doc.
You're welcome. Any more questions? Wala na? Kung wala na, it's may 3, okay. 2:53. Pwede tayo mag-off na. Okay. So if there are no more questions, we'll call it a day. We'll see each other next week again. Na? Okay?
Yes, Doc.
Okay po, Doc. Happy weekend.
Thank you
po, Doc.
also.
Thank you.
Thank you, Doc. Happy weekend. Bye-bye.
Bye-bye.
Thank you.
Thank you po.